Welcome to Dateline Health. This is Fred Lippman coming to you from the Alan B. Levan Center at Nova Southeastern University, which is a cooperative venture between NSU and Broward County. And today we have a very important group of individuals of which we're very proud of. It's the HCA University Hospital CEO, Madeline Nava, and also Lance Richards, who is the Vice President for Quality and Risk. Please tell us about what's going on. HCA University Hospital is basically new to the community. We know that the ER has been there for maybe a half a dozen years, but tell us what's going on at HCA University Hospital.
Sure, I'd be more than happy to. So the hospital has been in Davie for a little bit over a year. We just celebrated our one-year anniversary in November, and really it was an exciting first year for us, being the latest medical resource in the region for the residents of Davie and beyond. We are really excited to be able to bring the latest in terms of healthcare innovation and technology to the community. We are part of HCA, and as such, it was a $350 million investment in the community and in the hospital to make sure that we had the latest healthcare available to the residents of Davie. And really, this last year has been an exciting one. We have a full range of healthcare services in addition to the emergency department, which was here, as you mentioned. We built the hospital around it, and really our premier services that we offer to the community, in addition to emergency medicine, surrounds orthopedics, our neurosciences program, and we'll talk more about that. Maternity care, which we're very proud of. We take care of high-risk maternity patients and offer level 3 NICU care should their babies require a higher level of care, as well as obviously minimally invasive surgery. We do a lot of robotic technology as well. And so really has been an exciting year as we've watched those services grow as the community gets to know us and use us and access us for their care.
We're also very proud of the many graduates that come out of our Nova Southeastern University Health Professions Division that are serving both the hospital corporation's needs, but more importantly, if I might say, the community's needs, which is really the purpose for having a quality caregiving venue called a hospital. Lance Richards is the Vice President for Quality and Risk. Welcome to the program, Lance Richards.
Good morning. Thank you very much. I appreciate it.
Tell us, I think we had an off-camera discussion about the new, I guess you could say, certification of HCA University Hospital as a stroke center. Would you want to explain that to the folks?
Absolutely. Our hospital last year began our first year, began the journey to become a Joint Commission Advanced Primary Stroke Certified provider. Obviously, that's a very big deal. The Joint Commission is an organization known to so many people, and it really is a validation of the type of work that we do. We do see that as not an end destination, but again, when we talk about a journey to try and always continue to grow and improve our ability to provide the best possible care to our community.
Well, as we've had discussion off camera, the amazing advantage of having an advanced certified stroke center to the people that you serve and the community that you serve is dramatic because, again, and I'm not talking from a medical doctor's situation, but from many, many reports that I read all the time, is that, if someone ends up having a stroke, in quotes, and that happens very often, by the way. It happens on the roadways, it happens in the backyard, swimming pools, doing gardening or whatever. and all of a sudden, someone strokes quite, I guess in quotes, strokes out. The EMS people come along, and they have the immediacy of care at your certified stroke center, which, and again, I'm just talking from previous data, that if that person is taken to this advanced certified stroke center, which is now at your particular hospital, HCA University Hospital, that within the 80 to 90 minute zone, you're going to save their lives. True?
Yeah, and our goal, is to obviously to treat as quickly as possible. It's imperative that we identify when the person who presents was last well, if you will. That's a critical time because that allows us to put those types of treatments in place. For example, the implementation, the administration of a clot-busting medication that can literally be the difference between life and death. And so, our standards for our staff and for our facility are even tighter than those. We want to make sure we have that medication within 60 minutes. Our internal goal is 45. And so it's a multidisciplinary approach. We treat everyone, and that's the thing, minutes matter. And so making sure that, our board certified emergency physicians, our board certified neurologists, our nurses are specially trained to treat the patients, to recognize immediately what the needs are the patient, and then to be able to treat as quickly as possible. It really can be the difference between life and death for patients. And for any of us, again, I think that's important to all of us, to me as a vice president of quality, but also as a nurse, to make sure that the patients who come are able to get that highest level of care, and that people can come in circumstances that maybe in the past wouldn't have as great of outcomes, and really, we're able to treat those patients and have exceptional outcomes now going forward.
One of in the many years, we're in our 23rd year of doing this show, and it's amazing how over the last, I would say, 5 to 10 years, everyone is interested in, I would say, minimally invasive techniques, all right? And that's the essence of what occurs when someone comes in with a stroke, is that because you have to have the full-time radiologic services available 24 hours, correct?
Correct.
This is all done with minimally invasive techniques, and with the technology that's presented by HCA University Hospital is an imperative for you to be an advanced certified stroke center. So, Madeline Nava, you must be very proud of that designation.
We are proud, and our next steps are to continue to advance our stroke certifications that the Joint Commission offers, so that we can eventually become a comprehensive stroke center, and that is our goal. We are moving fast, but as Lance mentioned, we have the expertise on board between our emergency medicine physicians, our neurologists, our neurosurgeons, and our radiologists. So that is our goal for this year, to put those programs in place so that we can continue to expand the services within, again, South Broward and to the residents of Davie. So we are very excited. We also have 2 neurosurgeons that are directly across on our campus in our medical office building that offer different technologies and different surgeries for complex care. So we are very fortunate to have that expertise on our campus to continue to work with us as we expand programs.
Well, we've done some programming with those people that are in the medical office building, and we're very proud that 2 of them are graduates of our medical school program here at Nova Southeastern University.
Yes, absolutely. We feel that way. And you mentioned the 2 neurosurgeons. They are very proud to have been part of Nova, and we love having your students participating as we care for our patients and have them part of learning in our learning environment. So it's been a great last year, and we're so excited about the future as we grow within the community of Davie.
Well, and again, nationally, in fact, I was talking to a number of people that are involved with governmental work, both locally as well as in Washington, D.C., and they keep on asking me the same question about why is there such a nurse shortage. And we have 4 nursing programs in the state of Florida.
We welcome having the nursing students from the Nova program, and HCA actually started a program. We call it our STAR-In program, and we take nursing students while they're still in training and put them into our program as well, hire them, and then the goal is really to bring them on board. So they get to learn HCA Florida. For us, they learn our hospital, and then it's our hope that when they graduate, they come on board full-time with us and continue their development. And it's been a very successful program for us this last year, especially in light of the pandemic, and not unlike all the healthcare systems out there in the nation. They saw the nursing shortage just exacerbated. And so we've been very fortunate that we are partnering with Nova and some of the other organizations to be able to recruit new nurses and train them and have them basically continue their education with us.
I want to just again get back to the importance of the service which you've been providing to the people of Broward County dominantly, but eventually you started to get migration from what I would call Lower Palm Beach County into the services for the NICU and the step-down units, the difficulty of birthing problems and things of that nature. So could we talk a bit about that?
Sure. So, we were fortunate when we were at Plantation General. We had a very well-developed, comprehensive maternity program for high-risk maternity as well as low-risk patients. And so we had about 2,000 deliveries at Plantation. We did have our level 2 and level 3 NICU, and we were fortunate to be able to bring that team over. So our nurses are very tenured. Many of them have over 10 to 15 years of experience as a neonatal intensive care unit nurse. And we also brought our medical team, headed up by Dr. Rooney Toms and Dr. Mitchell Stern, and they are board-certified neonatologists. I'm sure you know them, with lots of years of experience. And they do a phenomenal job with their team of physicians, as well as we have mid-level providers that also assist in the NICU. And it really is a multidisciplinary team. Again, very well developed because we just brought that expertise from Plantation, but we've continued to grow as we've been here. Last year we saw our NICU census increase from where we were at Plantation, and I think largely because the word is out there in the community that if you have a complex case or you are a high-risk patient, you want to make sure that you're getting the utmost in care and that those resources are available should your baby require, a level 3 or a level 2 NICU or even other medical emergencies that we would admit to our neonatal intensive care unit. The other thing that has been really successful this past year is we have maternal fetal medicine physicians. We have 2 physicians that are full-time on staff, and they round daily on our patients that are getting ready to give birth, and they're also part of that care team. In addition, we've got hospitalists, OB hospitalists, and those physicians are on staff here 24/7. So should an emergency present and mom presents to our ER, they are immediately seen in our OB ER, where we have a triage department that will triage that patient and assess exactly what the medical emergency is and make sure that they get immediate care. So even if our patients have a private attending in the community, if they come in The OB hospitalist is there to see them and then communicate with their physician regarding what's happening. And again, it's just been very well received by the community. As the word gets out there, they know that they can access our facility for that care. So it's been a big success.
Well, I've discussed this with you off camera, but I have a great interest in that particular venue or provision of service. Let's put it that way, because everyone talks about caring for children, but the caring for children begins before birthing, and there's a great deal that has to be done relative to overseeing the emergencies, dealing with them immediately, and having the NICU and the standards with which you present your care is a blessing. Not only to this community, but really to any person who shows up at your ER. So thank you. We appreciate it. Lance Richards, as Vice President for Quality and Risk, I don't know whether any of that risk tends to get into what Ms. Nava has just spoken about. So why don't we get involved with you on this issue?
As far as the NICU and women's services, I go back to, I'm a healthcare risk manager, and my background is in nursing, and I like to tell nurses we're all risk managers, in one way or another. But really, it has to do with making sure that, and just like with a certification, making sure that we are providing the highest quality care, and that our policies, our processes, our order sets, all are focused on that end, everything. And so, I tell staff that you have to do the right thing all the time, right? We can't, we're in an industry where, unfortunately everyone to err is human, and we know that. But we want to make sure that our processes support staff. And so those situations where inevitable human error, that they're supported, and that the processes prevent patient harm. And so, to that, we also look at we have tons of data. That's one of the benefits of being part of HCA. We look at a lot of our outcomes data, and from that try to formulate action plans that are going to improve our processes. It's about processes and trying to improve those so that we can have the best possible outcomes for our patients. And so it's continuous. It is a culture of continuous process improvement and a culture of patient safety. And those things are just key to helping us further our mission.
Well, we had a discussion by conversation with one of the viewers. People take care of their cars, they take care of their gardening, their lawns, they take care of their roofs, and then all of a sudden, when they have a medical issue, they wonder why it occurred. Now, obviously, we all have different molecular body structures, but the reality is that prevention is the designed care of preventing a good number of these very, very difficult situations which we've just been talking about. And there are so many other things. I mean, there are cardiac issues, cancer issues, et cetera, et cetera, et cetera. But it's really wonderful that someone like yourself is willing to say what you just said, because coming from your nursing time and nursing career, there is nothing that's more important than making sure that you present as best a human being as possible. Now, I understand there are costs in relation to work hours and things of that nature, but everyone really does they have the responsibility. I always tell our viewers, you got to take good care of yourself. And the way you take good care of yourself is you got to go and speak to your doctors. Madeline, what do you think of that?
Yeah, no, I absolutely agree. And, as part of our mission, our goal is to really continue to get out into the community and educate on prevention. We've done some this past year as we've opened the doors to the community and participated in various events in Davie and Cooper City. But I think what's going to be really critical for us as we move forward as well is to really make sure that education is a key component of what we do for the community. We've already partnered with our emergency medicine providers, the town of Davie. We continue to do a lot more along that as we go forward, especially for this year. We talked a little bit about stroke and our certification, and our stroke coordinator has been out in the community to do education on stroke prevention, and more importantly, recognizing the signs and symptoms, as Lance talked about, for timely care and intervention should that become necessary. So yeah, I absolutely agree with you. I think the education is important, and the more that the community knows and understands, the better it is for them to prevent any hospitalizations or medical issues as they move forward.
Well, you mentioned two of the attendant cities immediately to the hospital. You talk about Davie and Cooper City, but it really is very important, as you know, as a executive, the CEO of HCA University Hospital. It's important to get out there, not just to tell people you got a wonderful hospital, but to let them know that there are questions that could be answered long before they have to get to your hospital. I'm very pleased to know that you're out there in the community, to the chambers of commerce, to the various opportunities that are available, whether it be the JCC or whatever it is. There are the churches, the synagogues, wherever they are. I think it's very important, and you've already said it, but I thank you. And I think it's very important to get out there to let them know what you have.
Thank you, yeah. No, I was going to say thank you very much. I appreciate that.
Okay, well, we're down to the last minute of this show. Actually, a minute and a half. So, Lance, is there anything you want to add in the next 15 seconds?
Only that, just to piggyback on what you both have said, health literacy, we know that's something that is a major need. And one of the key components of that certification is education to the staff, to the physicians, and to the patients and community. So we're going to continue to do that as we go on our journey to even higher certifications for stroke and to give the best possible care.
Well, I want to thank both of you, Madeline Nava, the CEO of HCA University Hospital, and Lance Richards, the Vice President of Quality and Risk at HCA University Hospital. We really thank you. Like I said, we're neighbors, so as we used to say in my hometown of Brooklyn, we hang our clothes on the same clothesline. All right, so let me just say to the viewers, remember, take good care of yourself. Don't stay away from your doctors. Talk to your doctors. Make sure that they understand what your little problems are. And remember, this show is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.